Every person with an intellectual disability is an individual with a name and a life. We are not just a collection of behaviours or syndrome, but people with intellectual disabilities are very often treated as if we are nobodies, as if we are invincible. The standard of mental health care for most people with intellectual disability at the moment borders on neglect. When the draft National Mental Health Plan came out in 2016, it did not even mention people with intellectual disability, even when we do get to see the doctor. It can be really hard for people with intellectual disability to explain to the doctor what's going on if they are mentally unwell. We need the doctor to take lots of time to listen properly, to get to know us, and not just to write us off as too difficult. A lot of people with intellectual disability can't talk or explain in words how they feel. They communicate how they feel by their behaviour. There are not nearly enough doctors and nurses who understand how to work out mental health problems for a person with an intellectual disability.
In the various portfolios that I've had, both in opposition and in government, I have seen the challenges of people with intellectual disabilities, disabilities more broadly, mental health intersecting with disability. It becomes just one more giant step that you have to cope with. The system itself, health, from my experience, people do want to do the right thing, but quite often the doctors, the nurses, the allied health staff don't really know how to work with people with a disability. And of course the person with the disability. Listen to the person with the disability.
And one statistic that stands out is the tenfold higher rates of recommendations for antipsychotic treatment for this group, which doesn't really match the known increase in prevalence of mental disorders. But we saw that people with intellectual disability experienced much longer inpatient mental health stays, and this is what determines the higher overall costs.
But overall, what we still haven't achieved around Australia is getting the mental health needs of people with intellectual disability into the fabric of mainstream mental health thinking. All too often, we see valuable initiatives that just don't seem to have thought about people with intellectual disability. On the positive side right now, and this we're hoping is a really important positive side, the final version of the 5th National Mental Health Plan squarely spells out those mental health disparities experienced by people with intellectual disability. And that to us is probably the core of what we're here about today, getting right into the fabric of mental health thinking.